Good morning, everyone. This is Christian Gallardo with BiPros Insurance Professionals. I'm your Vice President of Sales for Individual and Family Plans and Medicare Advantage. Thank you so much for joining us this Friday morning. Today's session is going to be hosted by Angie from Welbe Health. She'll be discussing Welbe's program of all-inclusive care for the elderly, also known as PACE. Just keep in mind a couple of housekeeping items. This training will be recorded and will be available on iPros' YouTube site to use at your discretion. So with that, I will hand the baton over to Angie to introduce herself and talk to us about how Welbe Health PACE program could be a good option for your clients. Angie, welcome. Good morning.
Thank you. Thank you, Christian. So my name is Angie. I am with Welbe Health PACE. I am the Southern California Broker Relations Manager. So if you're here in Southern California, you're going to be working with me quite a bit. So today I'm going to go over a general overview of our PACE program, why it's great for your clients, and then what kinds of commissions and benefits you get out of doing this as well. So I'm going to go over that in a presentation. So is it okay if I share my screen?
Yes, please.
Okay, perfect. All right, so hopefully you all can see my screen. I'm on a single screen today due to travel, so it's a little bit harder for me to do my presentation without that dual screen. You get on that dual screen, you just get real dependent on it. All right. So I'm just going to introduce PACE and our locations. So we are the company. So Welbe Health is the company. The program is PACE, Program of All-Inclusive Care for the Elderly. That is a federal program and oversighted by the feds. You'll see here are different centers in Northern California. So we just opened up San Jose in January. And then, of course, we have Stockton and Modesto, as well as Fresno. And then Southern California is made up of our Long Beach, Rosemead, Pasadena, North Hollywood centers in LA. And then our centers in the Inland Empire are Coachella Valley and Riverside. We do have opportunities, often quarterly mixers, to come and check out our centers and be able to take tours. We also host Senior Saturdays. And the Senior Saturdays actually are like a sample for your clients to really get to know the PACE program, have lunch with us, play a game, have a tour. And we do it on Saturdays because we know a lot of families out there do need to see the center as well before mom, dad, or whomever their loved one is signs up for a program like PACE. And feel free to jot your questions into the chat box. I will look at those and answer them towards the end. So feel free to do that. What makes PACE programming so unique is that PACE is the insurer, the provider, and the care site all rolled into one. So PACE is a Medi-Medi plan. So about 86% of everybody joining PACE programs are your traditional Medi-Medi duals. We can also take Medi-Cal only. Medi-Cal's more key for people joining our program than the Medicare is. So we can take Medi-Cal only, and about 13% of our folks coming to us to join our program are actually Medi-Cal only. We can also take your individuals who are partial Medicare but have active Medi-Cal. So if they have Medicare Part A only and they have active Medi-Cal, they could absolutely take a look at the Welbe Health program to join for all the services that we offer. We cover all specialist procedures, hospitalizations, and long-term care. So we will follow our seniors through from where they join us today, maybe right from their own homes, all the way through that long-term care. So if our seniors ever need that higher level of care, such as a skilled nursing facility, we will follow them through with that. We will help pay for it, and we will continue to be their insurance, their provider, and their care site. Okay. One of the first hurdles you'll need to get over when you do start working within PACE is the provider of the primary care. all PACE programs have their own panel of primary care physicians. So our clients need to be willing to switch from who they see today as a primary care provider and be willing to switch over to the PACE PCP. I do get objections, of course, to this because many of our seniors are very attached to their PCPs. So I pose this in a fashion of our PCPs at Welbe Health are limited to 125 patients annually assigned. So it's a very, very low patient count. And what this allows is for us to have more availability of appointment times. We can typically get our seniors in to see one of our providers in 48 to 72 hours upon their call. In some cases, we may be able to see them in the same day as well. We have longer appointment times. So our appointment times are no longer limited to the 5, 10, 15 minutes. Our first average appointment is about 1 hour. They're also not waiting around in a lobby for the doctor to see them if the doctor is running behind. Though they may not walk in the front doors of our center and immediately see the doctor, there's other services in our center that they may be receiving that day, such as physical therapy, occupational therapy, nutritional counseling with our dietitian, mental health services from one of our LCSWs, or a variety of other activities that they may be doing in a social engagement, such as bingo, arts, crafts, things like that. Then we have social services. So we do have social workers who help our seniors connect with additional resources in the community. And every single senior joining our program will also have a care plan. And that care plan essentially maps out the next 6 months for them. So they know exactly what they're going to be doing. And we also have our seniors' goals in mind. So if our senior has a goal of, I want to go from primarily using a wheelchair to using a walker, that is fantastic. We will help our seniors with their goals. On our care site, we do have a primary care clinic. We have a physical and occupational therapy gym. We have a socialization area, which looks very similar to anything else that you would see out there when it comes to senior centers. We have a nutrition area, so we do have a kitchen on site. We serve light breakfast and lunch every single day, and this is free to our seniors. And we have a personal care area. So we do have a salon and spa on site. So we have a hair salon where they are able to get their hair washed and set or styled, and simple haircuts right now. Nothing, no dyeing hair, no perms yet, just simple haircuts. And then our personal care area does have a walk-in tub, roll-in showers. We have laundry facilities, of those things to help our seniors with their personal care and hygiene. At the heart of every single PACE organization, you will find the interdisciplinary team. So this is a team of individuals that are hired directly by the PACE organization themselves to provide the care in that specialty or discipline for our seniors. So you'll see here we have, social workers, physical therapists, engagement coordinators, dietitians, transportation, speech therapy. All of those things are offered right in our center, and we direct hire those individuals. So it is a great opportunity for our seniors to get the care that they need. There's no caps or limits on any of this. So if they're looking to do physical therapy, a lot of our insurances ask for really big leaps and bounds from our seniors. Not all of them can make those big leaps and bounds. But if you put together enough baby steps, our seniors will eventually make a big leap or a bound. So we can work with our seniors long term and counting all those baby steps of success that they have. To break down the services further, our medical care is personalized care. That's where the care plan comes in, and it's from experts in senior health, so geriatricians. Our prescriptions, big deal here. We have no formulary. So again, we have no formulary. So if it's medically necessary, we cover it. There are no co-pays or out of pockets for our medications, and all of our prescriptions are home delivered. We also have an over-the-counter program as well. And we do need to know what the seniors are using for their over-the-counters and their medical necessity so that we can also continue to cover the cost on those. So some examples of those may be vitamins, it may be seasonal allergy medicine, cold medicine, cough drops, incontinence supplies. Those things are all covered by us. And again, same thing with our prescriptions. They're all home delivered directly to our seniors. Home care. This is a great time to bring up that IHSS and PACE cannot coexist. So how we get around that, because oftentimes those IHSS workers are family members, we as Welbe Health are able to hire those caregivers through our third-party agency, and so they can continue being the paid caregiver for their loved one or friend. So it does take approximately a month to onboard a caregiver. So I do let everybody know that if you have a family member or a caregiver that would like to be onboarded, the sooner we know, the more success they have in getting onboarded. And the pay is similar. So right now, IHSS pays somewhere between $17 and $21 an hour, depending on the situation that people are finding themselves in. So obviously, memory care is a little bit more. And then your typical light housekeeping might be a little bit less. And then our hours are fairly similar to IHSS as well. However, because we do have our own transportation department, you can actually see that straight across. Our transportation is going to do all the transportation to and from doctor's appointments for our seniors, as well as to and from our center. So the transportation is no longer going to be on the caregiver to get the client to a doctor's appointment. It's on our transportation staff to do that. And our transportation, the vans are Welbe Health, the drivers are Welbe Health employees, and we have local dispatch at every single one of our centers. So that makes it really easy for us to coordinate all of that care. We are also threshold to threshold. So that means we're going to go up to Mrs. Jones' door, knock on the door, and help Miss Jones get out of the house and into our van. Social engagement. I always tell agents, do not underestimate the power of social medicine. It is incredibly powerful, our seniors being able to engage in activities with their peers, but also with our staff as well. They will do activities, games. Sometimes we do outings from our centers as well. And then we do have some virtual activities on our GrandPad tablet as well. So I will show you our GrandPad tablet here in just a moment. Care coordination. I think that's one of the big deals with a lot of our seniors and their families is care coordination can get quite overwhelming for them. And so sometimes they don't know how to do it, who to call. And so with our team, they have an entire team to help them care coordinate for their loved one or for themselves. We also have dental. So dental's huge. We have a dental suite in all of our clinics, and the dental is your regular cleans, your deep cleans, extractions, fillings, partials, and dentures at no cost to our seniors whatsoever. I get asked a lot about root canals and crowns. In some cases, we are able to do that for our seniors, but they must have the jawbone health and gum health as determined by the dentist to be able to have that procedure done. Not all of our seniors have that oral health to be able to withstand that procedure. It's pretty intense, but it's all covered. Dental is 100% covered, no cost for our seniors. And then we also have vision and hearing. Vision is one time per year, the glasses, that's frames, lenses, fitting, as well as the exam. And then we also have hearing aids are covered, so they will see an audiologist first to determine the type of hearing loss that they have and the best hearing aid for them. Exercise is through our physical and occupational therapy gym, as well as one-on-one work with them. So who's eligible? This is the great thing. We start at 55. So we are 55 and older. They do need to reside in one of our PACE service areas. That is our zip codes. And I'm going to show you some maps at the end of this presentation so you get an idea generally of where we are. Meet nursing home level of care requirement. So I'm going to be going over that here just in a bit. It's essentially, I am looking for folks that have chronic conditions and are struggling in their activities of daily living. So that's probably the two biggest deals that I have right there is that I need to have their personal safety and they're not jeopardizing their health. So I'm trying to think of bedbound individuals. Typically, PACE programs look at bedbound individuals as not being safe for our program. They really look at those individuals as needing a higher level of care. So, bedbound individuals I cannot take into the PACE program. But I do want to make it clarified that if somebody can sit up, stand with a one-person transfer or assist, pivot and sit back down into the wheelchair, I can take that person, but I cannot take somebody that's truly bedbound. Okay, let's get this going again. There we go. Welbe Health and PACE Clinical Excellence. I just want to kind of highlight some things. These are national studies done on PACE programs when it comes to people that are in similar in nature of their health conditions, age, socioeconomic background, and that nature. So when somebody enrolls in PACE, their life expectancy increases. So they found that individuals in PACE programs increase their life expectancy by 3.9 years. That's huge. Could you imagine getting 3 more years with your grandmother? I was like, I would love that. Depression rates are cut by 80%. So our seniors may come to us initially depressed, but when they're in our program and they're engaging socially with their peers, engaging socially with us, the depression goes away. ER days plummet. We are so high touch that they're not going to the ER as frequently as their counterparts outside of a PACE program. And they typically live at home instead of nursing homes. And family members, whether they're the paid caregiver or they're just the, son or daughter, the satisfaction for them skyrockets because they know they now have a team of individuals that are going to help them with mom, dad, and uncle's care. And then Welbe Health outcomes during COVID was 10 times better than nursing home environments. So we were able to keep our seniors a lot healthier, a lot happier, safe in their homes. Again, PACE at home, unlimited transportation services, wheelchair accessible vans. We have a GrandPad tablet that has a need assistance button. It's like a concierge button. They have access to our medical staff 24 hours a day, 7 days a week, 365 days a year. And then vital delivery of medical supplies to their home. That's incontinence supplies, DME, dietary supplements as prescribed by our PACE dietitian, prescriptions. Remember, there's no formulary. Medically necessary over the counters. There's no limit on that. So we are there to support our seniors in their homes. This is just one of a picture of our GrandPad tablet where you see the heart and hand logo and it says specific PACE. That is on all of our tablets, and this allows our seniors to get access to us all the time. And then there's just another layers of things to help our seniors. There's calendars so they can always check their appointment times. There's Zoom on there. There's games on there. There's a calendar of events so they always know when the virtual activities are happening. So they always are aware of things that are happening. And we teach them how to use this. And I know that some of our seniors are a little hesitant of technology, but once they get this, because the GrandPad is actually made specifically for seniors, they start to really enjoy it. And I've seen our seniors out in the community with this GrandPad tucked up under their arm because they're taking it with them somewhere because they want to play with the games on it. All right. So why would agents want to do this? Well, here's some benefits to you guys. Because Medicare is not required, we can take those Medi-Cal onlys or those partial Medicares. So now your clients that may be calling you with referrals or maybe calling you because they only have partial Medicare, you now have a plan for them that they can access and you do get paid the same commissions. It doesn't matter if it's Medi-Cal only, doesn't matter if they're full Medi duals, it doesn't matter if they're partial Medicare with Medi-Cal, it's the same across the board. It's comprehensive coverage with no copays or deductibles. We also have a share of cost program. I don't know how many of you have ran across a senior with a share of costs on their Medi-Cal. It can be absolutely devastating for that family. So we have a share of cost waiver program. So if you have a senior who's higher income, really could use some home care, really could use some coordination of care, look at Welbe Health. We'll be able to help them with their share of cost. We will need their list of reoccurring expenses such as rent, mortgage, utilities, phone bill, grocery bill, credit cards, etc., going forth with reoccurring bills. But once we can see that those expenses are eating up the income, we can usually waive it. The largest share of costs that I've had waived personally for someone was $5,600 a month. That means that that person was making just over $6,000 a month. So that's absolutely incredible that we can change somebody's lives by being able to put in the care that they need without them having to figure out how to pay for it. We do not require a scope of appointments, so that's really helpful. We can do online and telephone appointments. We're year-round open enrollment, so we never stop enrolling. It's 12 times a year. I also have two methods of training you can do. If you're one of those super disciplined people, you could do it probably all online. I'm not one of those people. I really like interaction with others. So I do host an in-person training a couple times a month. My next training is going to be on April 25th in Pasadena. It's from 9:30 to 3. I can put the link in the chat here in just a moment. So the in-person training takes care of about 7.5 hours of the 12 hours required by the state of California. So please let me know if you have questions on that. And because you allow us to torture you with all this training, I do pay a $250 training completion payment with your first enrollment. So your first enrollment 762 plus that 250. So you're looking at $1,012 for the first enrollment. And then going forward, any enrollment thereafter is going to be at the 762. And again, that's regardless if it's Medi-Cal only, partial Medicare with active Medi-Cal, or your Medi-Medi dual. We also pay the annual renewals. They are paid monthly and they start on the 13th month. And an interesting fact here is that you receive full commission even if the person you're sending us is already on a Medicare Advantage program. So if they move from MAPD over to PACE, it's the full commission of the 762. I hope that's excited a lot of you. And then just for clarification about our enrollment process, really where our agents are lead generators. You're really at the initial eligibility piece. You're having conversations about PACE services with your clients and their families. You're confirming their interest in the PACE program. And when you're confirming interest, you are welcome to schedule a tour to come see one of our centers and tour the clients. You can also RSVP for them to attend one of our senior Saturdays. And then you review the primary eligibility criteria so that you're over 55, you have a chronic medical condition, you have some limitations in your activities of daily living or some struggles in the day-to-day activities. You have you live in a PACE service area, and then we take care of the rest. So that's where the assessments forward is all in Welbe Health. We do the home evaluations. We send the nurse out there. He or she does the level of care assessment. If any additional assessments are requested by the state of California, we will arrange for those. Most often those are the PCP or social work assessments. The level of care assessment from our nurses always submitted to the DHCS. California here has its own PACE nurse review board that reviews every single applicant to the PACE program. If they're approved by the state, they just simply go into the enrollment process where our enrollment specialist will do a comprehensive review of PACE services with the senior and their caregiver or family. And then the enrollment is actually initiated at the first of the following month. So we're signing a lot of people right now, and they're all joining us to start services on May 1st. If they are denied, then we would need to refer them to other services, though they are welcome to appeal the decision of the state as well. For our agents, we have an online application as well as fillable PDFs. If you use that fillable PDF, you will need to use the Dropbox or fax it to us. And then we simply take care of the rest. And when you go through training with me or online, or you schedule a one-on-one training with me, you are welcome to, I will teach you how to do both. And then you can pick your preference. Our residuals are good for 20 years. And then I'm going to go over some pictures and maps right now. This is a mobile clinic that we serve in some of our areas, but our vans look very, very similar to this. Once you're certified to sell PACE, you can sell in any of our areas. So if you typically are in LA and you have a client calls you about her sister in Fresno, if she is eligible for PACE or a good PACE candidate, please feel free to send it our way. You are not restricted in any way to an area of where we are. You can sell in any of our catchment areas. So this is Stockton and Modesto's map. Pictures of their center. And I want you to take note of the pictures of the center because you will see how consistent we are with the colors, the furniture, the style of our buildings. We want it to be welcome, open, friendly. We want our seniors to want to be there. And the bigger funding piece of our program is actually Medi-Cal. So to see a facility that looks this beautiful and accepts Medi-Cal only is amazing. Pasadena area encompasses our North Hollywood, Pasadena, and Rosemead centers. So the darker shaded areas are kind of our focus areas because they're a little bit closer to our center. But that lighter purple area, we cover fully from these three centers. It's a bit of a longer ride, say from like Gardena to Rosemead, kind of a long drive. So I don't always go after that area there necessarily. And I'll show you on the next map of Long Beach what I'm talking about. But definitely a big area out here in LA. And then these are just pictures of our Pasadena Center, our Rosemead Center, and then our North Hollywood Center as well. Long Beach is mostly South Bay and Long Beach, but I always highlight this. I call it the U right here, where you can see Lakewood, Paramount, Compton, Gardena, Hawthorne. These cities right now feed to our Rosemead Center. So it is a bit of a longer drive for them in our vans, or longer ride in our vans. So usually what I do in that area is either people that are desperate for that care coordination, daughter's completely overwhelmed, doesn't know what to do anymore. Share of cost people, nobody else in LA is going to waive share of cost. So we are it. We are a program that can get rid of that share of cost so they can access all those Medi-Cal services for free. So that's what I focus on. I call that the U around Long Beach. But we are going to be opening a center in Carson. And once Carson's open, it's actually going to swallow a big portion of that area you see there that's currently feeding to Rosemead. This is our Long Beach Center. I love that they highlighted their dental suite in their photos. Fresno's a very large catchment area for us, covering 4 counties, and pictures of their center as well. San Jose just opened up, so it does cover all of Santa Clara County as well as a sliver of Alameda, and pictures of their center as well. And then our newest center is accepting applications today is Riverside and Coachella Valley. They will formally open for providing services on July 1st. So we're accepting applications to get them through the process with us. And then we are going to formally do the services starting July 1st. So you can see that's a pretty big area there that we are actually going to be covering from Riverside and our Coachella Valley Center. So I'm very, very excited about it. It does cover a sliver, as you can obviously see, it does cover a sliver there of our San Bernardino zip codes as well. And I really would love to have you stay connected with us. This is a QR code to our link tree. You are able to actually schedule a one-on-one with me if you would like to learn more. You can also find our events there. Our event page link is there, so that we use Eventbrite. So you can always be informed of all the upcoming events that we host at all of our centers statewide. And then other items there, such as requesting assistance with an event that you're planning in the community, how to get to the application, agent portal, and that sort of thing. So please feel free to scan this now and get connected with us. And then our NorCal agent manager is Joe Tabancur, and his email's there. And I'm Angie Carnystrom, and my information is there. So I'm going to leave it there for just a moment so you guys can have a chance to scan that. And then I'm going to check I see there's a question in the chat. Okay,
Yeah,
so the
that's one
question
question.
was, is this available for full dual only? The answer is no. We'll take Medi-Cal only. We'll take the partial Medicare with active Medi-Cal, and then we'll take the duals as well. If you have a client that you think would make a great candidate for us, but they do not yet have Medi-Cal, no worries. We have a Medi-Cal enrollment team who can actually help your client apply for Medi-Cal, and they handhold that application from start to finish through the entire county process. So it's very, very helpful if you have a client that may need help with the Medi-Cal application. And then I think that's it for me on this presentation. Yeah. And then we have general broker support, general broker fax, general broker emails. So feel free to take a photo or just jot these items down as well.
Thank you, Angie, so much. One of the frequent questions is, will you be sharing the presentation or the deck?
Yeah, I can send that to you. I send it in a PDF version, so I can send that off to you as soon as we're done here.
Excellent. And then a reminder for all the agents, as Christian mentioned in the beginning, this will be uploaded to our YouTube channel. You can look us up as iPros Insurance Professionals, and all of these trainings will be available there.
Are there any questions that anybody has? This is a lot to digest when we're looking at PACE, and I do understand that. So please feel free to come off mute, ask a question, or type it in the chat box. I would love to have those questions.
Yeah, we're currently on webinar mode, so please go ahead
Okay.
and send the questions through the Q&A box or the chat box.
I love questions, so.
Angie, I just want to say, very impressed by the facilities. I've never actually seen the Welbe PACE facilities before. And I think this is really helpful and a great reminder to our agents that there are other options.
Yeah, absolutely. And sometimes agents do have a hard time figuring, what clients is it that we're looking for. So sometimes initially I start off with agents saying, do you have that client they call all the time? They need help with everything. They're calling you because they need your help to call customer service. They need help trying to figure out how do they get home care, or how do I get my transportation to pick me up? Those are the people I'm looking for, just so you know.
Yeah, and that's really helpful. Also helpful to see who qualifies, like you stated, Medi-Cal's, partial Medicare's.
Yes.
That's always good to have in their back pocket in case they come across a referral of someone they've already assisted, potentially with MAPD, but may only have Medi-Cal but fits the criteria. I think it's always great to have more quivers, or more arrows in the quiver, I should say.
Yeah, absolutely. And then we could work with the VA. So PACE and VA can coexist well together. So don't hesitate for some of those veterans who may still be struggling with their services, even though they have VA. They could be great candidates for PACE as well. And all PACE does is help them further coordinate their own care through PACE as well as with VA. Looks like I do have a question. It says, does the agent need to be with the beneficiary when they take a tour of the facility? If you don't tell me they're coming, my internal salespeople are going to take it. So I need you to let me know that you have a client touring, whether you turn in the application and tell on the application they want a tour first, or you call me up or call my broker support up and say, I need to schedule a tour for Mrs. Jones so she can come see the center before we move forward. Please let me know that before you just send them to the center. So you don't need to be there, but please let me know that you're sending somebody their name, phone number, etc. How can Welbe Health help VA clients? So since VA and PACE can coexist, with the VA, oftentimes they have longer wait times for specialists, and it's hard for them to get second opinions. And so what PACE can do is, since a lot of veterans opted not to take Part B on their Medicare, and so they're then therefore stuck in the VA system. They can't go anywhere else for care. And with PACE, they now have another entire network to access. So they could get those second opinions. They have less wait times for some of their doctors in the specialty fields they need. Also, VA has homemaker programs. So they can have homemaker programs, but they also might need additional hours. So they are able to look at our program for additional caregiving at home hours. We do transportation. And then some of our veterans are a little bit higher income. So oftentimes they have a share of cost on their Medi-Cal. And since PACE, Welbe Health, I should say, has a share of cost program, we're able to help those veterans waive that share of cost for themselves. I hope, does that answer the question, Beth? Or do you have like something more specific? I can tell you on the home care hours, I think it's VA homemaker and PACE's caregiver. PACE, or I should say, VA homemaker and PACE caregivers have to do two different tasks in a given week. So they're not going to be doing, say, laundry on Tuesday with VA and laundry on Thursday with us. We have to do different tasks during the week. If that doesn't answer it or doesn't make it clear enough, Beth, please ask, your question. If you have a specific example or scenario you want to run by me, please feel free to ask. All right. Does anybody else have any other questions? I'm not seeing any come up. Well, if you'd like to schedule a tour with me, please let me know. Please email me. Let me put my cell number into the chat for you as well. Two 27437. All right. So the number that and I don't know if I can have you guys share it for me, but I did put my number in there. So it is my cell number. You are able to call or text me. So if you want to take a tour yourself or want to know when our next events are, please let me know and I'd be happy to share that with you.
Let me share your phone number with everyone before
Yes,
they leave.
please.
I put it in the chat, but it's 714-274-3748.
That's correct. Yes.
There's another question by Beth.
Yeah, it looks like Beth, you want to give me a call regarding more questions for veterans? Please reach out to me. I'm happy to do that. It's a huge opportunity. And a lot of our veterans, believe it or not, do not realize that they qualify for Medi-Cal. They've been completely uneducated on the fact that they can get Medi-Cal. They just have a few extra steps, but they can get it. So, all right. Well, definitely, if you scanned my QR code, please visit my Eventbrite. We do have some events coming up, Senior Saturdays, and we also have a mixer that's going to be hosted at our North Hollywood Center.
Wonderful, Angie. Thank you so much for your time. We appreciate it. And we look forward to working closely with Welbe Health.
Yes, absolutely. Thank you so much. Have a great rest of your day and have a great weekend as well.